Hello, welcome to challenge number 4. This challenge is all about empowering patients. Now, before I give you the details of the challenge, we're going to speak to a lady called Angela Ruddock, who's a patient and public representative.
Okay, well, my name's Angela Ruddock. I am what is called a member of the public, lay public member. I have been involved for a few years now in working with researchers, usually in primary care, and looking at their research projects and providing advice sometimes from a lay public point of view about the way it's presented. Well, initially, patient safety didn't really mean very much to me because I was thinking in terms of health and safety, and it has a very sort of bureaucratic, feel to it, like health and safety, wearing safety hats, that sort of thing. And I understand now that it's a broader concept, and we're actually talking about ways that the patient can be treated so that they are safe in terms of the type of prescription, how it's written, that they understand what the drug is, the dosage, whether they have any side effects, anything like that, so that they have optimum knowledge really, so that they're able to take the medication in a way that is going to be a benefit to them.
Perfect. And how easy do you find it to talk to healthcare professionals, in particular pharmacists and pharmacy technicians?
Well, I think their role maybe has evolved over the years because one has this. Well, I used to have this idea of pharmacists being white coats, horn rimmed spectacles, behind the counter, just getting bottles, brown bottles, and then providing you with a piece of paper and just saying take this 3 times a day, whatever. And I think people realise now that it's more than that. The role is more than that. They're providing advice on a whole range of things now, and I think they recognise that it's important for the patient to actually understand what they're getting, why they're getting it, what the issues might be for them, and to feed back if there are any problems associated with it, particularly now if you think about repeat prescriptions and that sort of thing. So I think the role, certainly in terms of communication, for pharmacists and pharmacist technicians has been enhanced as a result of the need for better communication. I think it has evolved, but I think there are still issues where it's important for um, the patient to be seen as they're not scientists. They don't necessarily understand what you might take for granted. So, for instance, there are certain drugs that you don't take when you're when you've got to take other drugs as well. So they may not be aware of it, but it's important if you know the history of that person, if they've been on the prescription before, or that they're, from the information that you have, that they have got particular issues, then they're things that are useful for them to be raised. So, for instance, actually, is one thing I'm thinking of as well. A pill that or a prescription that can perhaps affect your ability to go to the toilet. If you're up, half the night with because it has that effect on you, that is something obviously that's quite important to an older person that may have issues around that, and to have those discussions before it happens would be very useful. Just an example, I'm thinking. So the communication bit is actually quite important. Plain English, so that the person can understand what he's saying, understanding what the dosage really means. Is it what does 3 times a day mean? Is it some people think, every 3 hours, or is it every 8 hours? And actually ask them, you know, how they find taking the tablets. Does it stick in your throat? Some people have a real phobia, I know I have, about tablets and tablet size. If there are issues around that, sometimes patients don't feel they can say anything, that they've just got to take it. But if those are inhibitors to people actually taking the drugs, and you actually feel, I don't fancy taking that today, I think I'm going to be sick, I think it's important that that discussion can happen. So it needs to be comfortable, time permitting, because we know everything is rushed these days. But if there's an opportunity to have that discussion with the patient, then at least that they are aware of some of the issues, and possibly the need to write it down so that they don't forget. Well, yeah, that's interesting. I think it's useful to have first of all, an opportunity for the patient and the pharmacist to actually have an introduction, if you like, have a discussion about, well, this is what I do, this is my role, I know you've had this prescribed, have you had them before? What have been the problems, that sort of thing, so that you can actually break the ice by that sort of introduction, and listen to what the patient is saying, rather than saying, you've got these, you take them 3 times, you've got to take them with water, you've got to do and actually just get them to tell you what the difficulties are. They might not, I'm the sort of person who can't take stuff with water, because I can feel it at the back of my mouth. I have to take it with juice, if there's a problem with that, or milk. Now, if there's an issue around that, acid or something, then that discussion needs to take place. But I think if it's set from the outset that what your role is, what sort of things you can do to help the patient improve the medication so that it works better, then so much the better.
I'm sure you'll agree, it's really interesting to hear Angela's point of view. What we'd like you to do for this challenge is speak to a friend or a relative who isn't a healthcare professional. Ask them what they think the role of a pharmacy professional is, and also ask them what would make them feel more comfortable to open up about their medicines and also their health in general. When you've completed this challenge, you can record it on the campaign page of our website.